Okay, today we're speaking about the kidney diseases. We're going to speak about 3 kidney diseases to be specific, and then we're going to finish off the lesson with ultrasound and why it is so important. The first kidney disease that I want to speak to you about is high blood pressure. High blood pressure where? The problem is when there's high blood pressure in the kidneys. Now, how we get high blood pressure in the kidneys is because the heart is very close to the kidneys. And remember from the previous lesson that 20% of the blood that's pumped out of the heart go directly to the kidneys first, without going anywhere else. 20%. So around 10% goes to your right kidney, around the other 10% goes to the other kidney. So think about the distance from here to here. It's not too far. It's not like your heart is pumping blood to your fingers or your toes. So it's a very close distance. So as soon as the heart pumps the blood, it smashes into your kidney. That's a good thing. We like the fact that there's high blood pressure because the kidney then, as the blood pumps in, it filters out some of the unwanted stuff. And the blood then does a U-turn back to the body. And the unwanted stuff get filtered out. So the pressure is vital. We need the pressure. The problem is when there's too much pressure. Too much pressure causes some of the capillaries to explode in the kidney. Some of the capillaries rupture and then the kidneys don't function properly. So then you have inefficient kidney. Your kidney starts working inefficiently. That's the first problem we can have. And by the way, around 500,000 Australians go to see doctors about their kidney problems. Around 500,000, that's a lot every year. 500,000 people go for kidney problems. The second disease is called kidney stones. I'm sure you've heard about this. Kidney stones is when you have stuff in urea. When you're trying to get rid of the unwanted stuff in your body, there are certain particles in urea that love to clump together. They love to stick together. And normally healthy people have something else in their urine which prevents this clumping to occur. Some people either don't have that or they have it but they don't function properly. So they start clumping up. And where does urine start to clump up? It starts in the kidneys. So if you start getting little groups of particles clumping together in your kidneys, how's it going to leave your kidneys? It's going to be very hard. You're going to have to somehow pass it out. It's going to have to somehow come out. And they say that passing a kidney stone is more painful than giving birth. Females say this. Females that have given birth naturally and have received kidney stones in their kidneys, they say that passing the kidney stone is actually more painful than giving birth, which is huge. I mean, and then if, we will understand maybe what giving birth is as a male if we have a kidney stone. So normal people, they have this liquid in urea that prevent the clumping to happen. If those kidney stones are too large, you might have to surgically remove it because they just won't pass through the tubes. You've got the ureters, the 2 ureters coming down, you've got a bladder, and then you've got the urethra still to pass through. That will be very painful, especially if the rocks aren't smooth. Sometimes it'll require surgery, or you can there's a device like an ultrasound. What that does is it shakes the rock particle, the kidney stone rather. It shakes that and then it just starts to crumble because it's shaking so much. When it crumbles, it's very easy to pass through. That's also a non-invasive. Non-invasive means you don't have to cut your body and put something in. That's a non-invasive technique, using ultrasound to break kidney stones. There have been very successful outcomes by using this technique. The third disease, very simple one. Basically, at the tip of your urethra, which is your male organ, you can receive bacteria from the outside world. Normally, urine is very sterile. It's like alcohol. If you urinate, you're actually cleaning your ureter, your inside. You're burning it basically, and bacteria can't live inside the tubes. But the problem is when a bacteria somehow creeps its way up, then you can have a urinary tract infection. Now, the most common one that I know of is E. coli. E. coli is a famous bacteria. The problem is with E. coli, now this is interesting, because E. coli can't live in your tubes, it must have come from the outside. And E. coli loves to live in the large intestine, in the digestive tract. So what is that E. coli, or how does it make its way to... I'll leave that question up to you. The last thing I want to talk about this lesson is the ultrasound technology itself. Remember the one I was speaking about to break down kidney stones? This is a little different. The ultrasound that I want to talk to you about today is the non-breaking down one. It's more to see what's happening inside. Back in the day, it used to just be black and white. And then two Australian guys, they introduced something called grayscaling. Now, imagine you're a pregnant woman back in the day, many years ago, and you're going for an ultrasound, and you can only see your baby in sharp black or white. And it's very hard to understand where's the head, where's the heart, is it flowing? So then these two Aussies, they invented something called grayscaling. So it's not just black and white, it's a grayish. So you have dark areas meaning, a lot of liquid, white areas meaning a lot of solid. So, and then you have these gray areas like flesh, that you couldn't see in the previous ultrasound. You're not going in for an X-ray when you want to see if your baby's healthy. You're actually going in to see the shape of your baby. And grayscaling now allows, you can see the direction of the heartbeat. You can see the direction of the blood inside the heart. You can see the 4 chambers of the heart. Previously, you weren't able to see that. You can see the tissue, if there's a cyst in the brain. You can see the internal structure of the eye, the lens. Are both eyes of the baby functioning? Does the baby have a developmental issue? Or if you've broken something like a ligament that you probably won't be able to see in an X-ray, you can check it out with an ultrasound. Or if you've got like a cancer somewhere on your body, you can get the ultrasound and check to see if it's actually cancerous or not. So there's a lot of things you can do with ultrasound, with grayscaling, thanks to these two Aussies. And I'm going to assign you homework, and the homework is Unit 3.5 on page 123, question 1 to 14.